Remember the early days of the pandemic? So many of us had this new ritual, right? Checking the numbers. We were constantly refreshing those public health dashboards, watching the curves, the case counts, just trying to make sense of everything. They felt like our lifeline to the truth. But what if the story they were telling us was missing some really critical chapters? What if, in an effort to protect us, they were actually leaving us blind?
You've probably seen a footnote just like this on a dashboard and didn't really think twice about it. Data suppressed for privacy. I mean, it sounds responsible, right? But this one, seemingly harmless practice was systematically wiping out crucial information. While we were trying to protect individual identities, we were inadvertently creating these enormous blind spots in our collective vision. And that's the central conflict here. This wasn't something malicious. It was the result of well-intentioned privacy rules crashing head-on into an unprecedented crisis. But in our effort to protect the individual, we totally failed to see the dangerous patterns emerging within the community. So, the big question is, what exactly was getting lost in the shuffle?
This number right here, reveals the sheer scale of the problem. 40%. Just let that sink in. That's the percentage of early U.S. case reports that were completely missing data on race and ethnicity. I mean, how can you possibly respond to disproportionate impacts on specific communities if nearly half the time you don't even know who's being affected? And this shows us the real-world cost. This is where it gets serious. When data from rural areas was suppressed because of low case counts, entire outbreaks just became invisible. Disability status? A complete black box. We had no idea. Early, really alarming signals coming from Black and Indigenous communities were just sanitized right out of the datasets. And the crucial point here is this wasn't just about numbers on a screen. It led to delayed responses for the very groups who were most at risk. So to really understand how this happened, we've got to rewind a little bit and take a look at the history of our public health data systems themselves, because they weren't built overnight, and they definitely weren't built with a global pandemic in mind.
This timeline really shows how these systems were pieced together over time. It's kind of wild, but public health data started with literal paper and fax machines, super slow and localized. Then, boom, a huge leap with electronic health records. After that, surveillance systems helped us spot trends, and finally, we got those polished dashboards we all became so familiar with. Now, each step was a huge improvement, but the rules of the road were being written for a totally different kind of traffic.
And that's exactly where we see the clash. You've got these systems, and more importantly, you have these rules that were developed in a completely different era, suddenly facing the demands of a once-in-a-century global crisis. The old playbook just wasn't going to work. A huge part of that old playbook is HIPAA. And look, we've all signed the forms at the doctor's office. We know what it is. Its purpose is absolutely vital: to protect your personal health information, to keep your patient records confidential between you and your provider. But its focus was always on that clinical setting, not a fast-moving public health emergency. This slide just puts that conflict into such stark relief. On one side, you have rules designed to protect individual records and prevent disclosure at all costs. But on the other, you have a pandemic that demands the exact opposite. You need to track community spread in real time to inform immediate public action. It was just a fundamental mismatch of purpose. So this brings us to this whole practice of data cleaning. And that sounds positive, doesn't it? Like you're tidying up the data, making it more accurate. But in this context, the cost of that cleaning was incredibly high, because this wasn't just about erasing typos. It was about erasing people.
So, for example, you have a rule that says suppress any county with fewer than 5 cases to protect privacy. Sounds reasonable on the surface, but in practice, it makes the very start of an outbreak in a small community completely invisible. By cleaning the data and removing these small numbers because they look like statistical noise, we erased the very signals we needed to see the most.
Okay, so this whole experience was painful, but it revealed some absolutely critical flaws in our systems that we can now actually work to fix. It forced a conversation about what our data is for and, maybe more importantly, who it should serve. So what are the key lessons we can take from this to build a better, more equitable future? Well, this points to 4 really concrete steps forward. First, we have to redesign our data processes to preserve those vital signals, not just scrib them away. Second, the rules for hiding data can't be made in some black box. They have to be transparent. Third, and this is so critical, we have to change our mindset. Small numbers aren't noise. They are often the very first alert. And finally, our dashboards need to be honest about what they don't know. Show us the gaps instead of some false sense of certainty. And it all really comes down to this. This is the ultimate takeaway. When a community isn't represented in the data, they can't be included in the response. The numbers we gather and the numbers we choose to hide have a direct and profound impact on people's lives. Because an absence of data is truly an absence of care.